Over 50% of cancer patients will undergo radiation therapy during their illness. One common side effect of radiation is radiation dermatitis or radiation burn. Radiation burn can cause the skin to be red, itchy, or swollen. It can peel, blister, and become dry and flaky, or even weep. Radiation skin changes become worse through the course of the treatment and will rarely remain stable. Typically, around the second week or about halfway through the treatments, a patient's skin starts getting red. That would be considered grade 1 radiation dermatitis. Whether a patient progresses to a grade 2 or 3 depends on the sensitivity of their skin and how well they take care of their skin during their treatments. Eventually, 70 to 87% of patients progress to a grade 2, which is actually a darker redness that might peel and be itchy and uncomfortable. 20% of patients will progress to a grade 3, which is a breakdown of the skin that might blister or weep. Unfortunately, stage 3 can potentially cause delay in the radiation treatment in order for the skin to heal. To offset the effects of radiation dermatitis, most medical professionals suggest a topical agent to apply after each radiation treatment. If products containing petrolatum or mineral oil are applied, the heat caused by the radiation is trapped in the skin, creating further breakdown damage and burns. This can cause the patient to experience additional discomfort and/or pain. In order to properly save the healthy and normal skin cells and to minimize the effects of radiation dermatitis, the skin in the area of treatment needs to be cooled, and the heat needs to be drawn out of the area of treatment. Radiation rescue can serve as the tool needed to minimize the skin damage.
When treating radiation burns, it's important to understand what a radiation burn really is. Skin reaction to radiation therapy can cause the patient discomfort and irritation.
As many as 95% of radiation patients will experience a skin reaction. The skin reaction can have an impact on the patient's physiological and emotional health, and it can be significant enough to limit or end the radiation treatment.
Typically, the effects of a radiation burn begin to show during the first 2 or 3 weeks of radiation therapy. The radiation burn can sometimes worsen as the treatment continues, but may remain stable after the first few weeks.
Radiation burns may heal after the first few weeks of treatment, but they usually require some further form of treatment. The purpose of skin care for radiation patients is to help manage their discomfort and skin damage so they are able to complete their treatment. Basically, they are treating the burn.
In order to specifically meet the needs of these radiation patients, we've created Radiation Rescue. Radiation Rescue is based on the original and proven burn-free formula, but has been modified specifically for maximum effectiveness on radiation burns.
Radiation Rescue is a lotion-like hydrogel that you don't rub into the skin. By placing a thick layer of the gel over the radiation burn area, you're able to pull the heat out of the skin, minimizing the damage to the skin.
The thick layer of gel also covers the exposed nerve endings from the burn, offering immediate pain relief to the patient.
Although similar to a sunburn, a radiation burn can go quickly from a first degree to a very serious burn. By keeping the burn area cool, Radiation Rescue is able to minimize the damage to the skin.
Radiation Rescue's cooling and soothing relief helps to make a difficult situation just a little bit easier.
Approximately 14 million people are diagnosed with cancer globally each year. 2 out of every 3 cancer patients in the United States will receive radiation treatment. Radiation Rescue is a specially formulated silky gel that provides immediate pain relief by covering the exposed nerve endings while cooling the skin to minimize further skin damage. This means Radiation Rescue provides relief from the pain, heat, and discomfort of a radiation burn. Apply a generous layer of Radiation Rescue to the affected area. Allow it to remain in contact with the skin for 30 to 60 minutes and reapply 3 times a day or as needed. Radiation Rescue is easy to use and completely water soluble. It is an absolute must for anyone undergoing radiation treatment.
don't think you need to see like the total fuzz to know that I'm legit. I normally don't wear my hat, but that is real.
It's reality, so it's whatever you're comfortable with.
I prefer to wear the hat. But if it creates a glare, I came across Radiation Rescue and I read through the ingredients and I really liked that it was water-based. Decided to give it a go, used it from day one, and follow the little instructions on the bottle. Around week 4.5 after my bolus, it started flaking. But as soon as I put it on, it was fine. The Radiation Rescue has definitely helped. I also think choosing to eat healthy and to maintain an active lifestyle and to do the stretches, I think it creates for maybe a holistic approach. I would definitely recommend Radiation Rescue. I have different tools to help me through situations, and I feel like Radiation Rescue was the best tool for radiation. There you go.